Good afternoon, everybody. It's Tuesday, March 24th at about 3 p.m. My name is James Gore. I'm a county supervisor here in Sonoma County in Northern California. I'm also an officer for the California State Association of Counties. I'm going to do my best to provide everybody an update on the statistics around COVID and coronavirus, what we're doing in our jurisdiction and in other jurisdictions, and what we can all anticipate in the coming days. So I'm going to try and hammer as much as I can into a short amount of time. Just an overview of the things that I'm going to go through. As I mentioned before, is where we're at with numbers, with caseload, with the amount of testing, test kits, what's the expansion and the goals on that. Talk a little bit about essential services and our shelter-in-place order and the states as well, and make sure we're aligning in a good place so that folks know as much clarity as possible what that is. Want to talk a little bit about not just what we're doing in the current day, but what is our prognosis? What does it look like for the coming weeks, months, and ultimately the year, so we can set our expectations right. And then I want to talk a little bit about some of the actions that are taking place with the different task forces in ours and other communities. Things like surge capacity for hospitals, food resources, food banks and others for, communities and at-need individuals, supportive services for homelessness, plans for personal protective equipment, childcare services for healthcare workers, and moratorium on evictions and other things. So I know that's a lot, but I'm going to do my best. So the first thing is that as of the filming of this video at 3 p.m. on March 24th, worldwide there are a little over 415,000 diagnosed cases of COVID-19. Let's say that those are the diagnosed. We know that many people are asymptomatic, so the numbers coming out of China, Italy, the United States, Iran, South Korea, and other areas that are either former hotspots or becoming hotspots, it's difficult to get an exact number because we don't know who are the people who are not tested. So it's also very difficult to then assume what is the mortality rate. If you look at the numbers for the world with 415,876 diagnosed cases, at 18,574 of our brothers and sisters already passing away from this, that would be a 4.5% mark on mortality. If you juxtapose that against the United States, where there's 52,145 cases and 677 deaths, that's 1.3%. So obviously, we're also at the beginning stages. Our numbers aren't the same as what China and Italy would see, where there's more maturity of COVID-19 and coronavirus in those areas. So the data is moving, and it's something that we have to chase relentlessly. In California, we have 2,327 cases, 45 deaths. Here in Sonoma County, we have 34 cases and one individual who has passed away from COVID, who was on one of the cruise liners. Prayers for all those family members who are going through so much difficulty, whether losing or having somebody in an isolation ward that they can't even communicate with. Talked to two of my friends, one particular in Italy, my buddy Marco, and he talked about what that's like for families to not have access to individuals after they're put into isolation areas. So we got an update from our county health officer, Dr. Sundari Mace. She is our county health official, as I mentioned before. We had a board meeting earlier today. She talked about the shelter-in-place order, which in some communities has been called a stay-home order, extreme social distancing. Basically, what's shown is that it needs more enforcement. And so I had a conversation with our sheriff, and he and the police chiefs throughout our county and statewide are in communication, and it's going to be a complaint-driven system. For those out there, the goal is not to fire up 911 with these calls. It's if there is a germane, a relevant complaint, not just you trying to catch somebody, but like this really shouldn't be happening. This kind of business is open. Police officers and sheriff's officers are going and making visits. Make sure you contact your local jurisdiction or the jurisdiction wherever that's taking place. So if you're in a city, call the city police. If you're in the county, call the sheriff's office. But once again, do that by calling them directly or even calling the 211 system. Do not call 911, an emergency line, for compliance. Many people have seen and not really liked the orders that recently changed that closed down parks, not just our county regional parks, but also school parks and other things. But the big issue here is that we have not had good compliance with the stay-at-home order, and people are not practicing social distancing, and so the rules are becoming more stringent to try and get ahead of this. We are still trying to flatten the curve, trying to make sure that many cases do not come in immediately in the coming weeks and months. So secondarily, exams and tests, there's some distinction and some differences throughout different counties here in California. Sonoma County, for example, we have a shortage of swabs, and that is limiting our ability to do tests. We have requested those from the Strategic Federal National Stockpile. We are hoping to get those in the coming days, and other equipment like even masks for our healthcare providers, so that we can make sure that supply is not limiting our ability to run tests. We want to get more tests out into the community. Dr. Mace has been very clear about that, and it's needed moving forward. We want to test more people so that more people who have COVID but are asymptomatic can be in isolation areas where they're not infecting others that could ultimately suffer more detriment and more harm. So testing is anticipating to ramp up. But once again, it's dependent upon those supplies. Essential services or essential businesses. Some people have been communicating with us and asking questions. Dr. Mace was very clear that for our health order, and I think you can think about this for other areas, the health order is really directed towards getting social distancing. It is not a full quarantine. They are trying to make sure that economy can run in the areas where it can be practiced under social distancing. The goal is not to tank every industry that's out there, food and ag with perishability issues, defense contracts. So some of those are listed under essential services, but the overall goal of our county health officer, and for me as an elected official taking doctor's advice, her advice, just as I would as an individual taking my doctor's advice, is to make sure that we do what is needed and ramp up enforcement, but also let the flow of goods and services move if they are practiced under social distancing. That is the key here. The other thing that I want to let folks know is that the two worlds from an epidemiology and from a medical standpoint is contain and mitigate. What we want to do is to effectively ramp up exams so that we can contain the cases that are locally. The mitigation, what falls under the idea of mitigation is our shelter-in-place orders, our practicing good hygiene, and all the things that can lessen the extent of the spread through our managing our lives through improved best practices. Additionally, I want folks to know that while these are the issues that we're dealing with in the current moment right here before us, at the same time, we also have to think about how we're going to manage ourselves in the coming months. There's a good chance that there won't be a vaccine for COVID available, COVID-19, for a year. So we have to be thinking about our loved ones. For me in my situation with my mom and my stepdad, and one of them has a limited immune system. And when are we deciding to see each other? How long are we going to hold shelter in place? And so I'm going to follow doctor's orders and follow Dr. Mays and my other doctors, and figure that out and make sure I apply it to my family and not just speak about it to you all. On the other side, from our emergency services, our Department of Emergency Management, couple things that are going on there. Number one is that folks need to know that there was a presidential major disaster declaration made by President Trump in response to a request from Governor Gavin Newsom. That makes public assistance available, and as we know, nominally, it makes individual assistance available as well. When we went through fires in 2 of the last 3 years and had in one of those fires individual assistance allowable, that was $32,000, $34,000 for each household that they could get. We're going to try and figure out if that's what's going to be delivered by the federal government, or if they're going to focus only on the public assistance. There's a lot of money, a lot of complexity with the idea of millions, tens of millions of people having to apply for this, hundreds of millions in our country. In addition to that, here in our Department of Emergency Management, our Emergency Ops Center, we have stood up 4 task forces. That is alternative care sites. So what that is to allow for surge capacity. So the first goal that our health officials have been doing is working with the hospitals and trying to use the hospital's expertise to say, what is the surge capacity? How many additional patients could you handle in your facility or in adjacent facilities? And then what we are looking to do as a county is identify other sites for non-acute care so that the hospitals could take care of those requiring who are above and beyond normal symptoms or above and beyond asymptomatic, those who need urgent care, ventilators, other things like that. So we are working with private sector individuals and public facilities to identify those and make sure that we achieve a surge capacity that's commensurate with the need in our community. We're also looking with other counties, Mendocino County recently and us, talking about regional models. The second task force is food resources. We need to ramp up deliveries to handle the surge capacities or the surge needs of individuals out there. Currently, the data shows our folks that there hasn't been a huge need for delivery service above and beyond people having to go to grocery stores and other things. But what we do need going forward is to make sure we're ready for that, and especially for our most vulnerable. The county is looking to later today sign contracts with 4 service providers who already do delivery services, some of our local food banks, some of our local meals providers, to make sure that we support their efforts to get out directly to people in need, whether those are seniors, whether that's individuals who are sick, home care, disability, whatever that is, but then also to the wider community, but a focus on those individuals who have access and functional needs issues, which means not free and clear, able to move to and fro and get access to their other things by themselves. The third task force is supportive services for homelessness. The governor has created a fund to support counties and cities with the rental of hotel and motel rooms. Sonoma County is looking at an initial tranche of 450 rooms that we could identify that would allow us to get people off of the streets and out of COVID-rich environments and disease-spread environments. And we're also having to practice social distancing in our existing shelter network. And for those who have worked in shelters, that's not something that currently exists readily. So we're trying to move effectively and quickly on that. The fourth is the most difficult to say out loud, but it's our responsibility to plan for it. And it's planning for mass fatality. When I say mass fatality in a community like ours in Sonoma County, that does not mean we're looking at a 500,000 people. That does not mean we're looking at 100,000 or tens of thousands, but it does mean how do we manage more fatalities than we do in a current year, in a common year. I've been told that we have around 4,000 deaths annually in Sonoma County. If we have an additional 1,000 or 2,000, how do we manage that outside of the coroner's office, normal operations? How do we manage it with situations where there could be disease spread from that world and from people who've passed on? This is a very difficult one because, as we know, how can you talk about that so directly without talking about the compassion and the needs of families and individuals? But I just want folks to know that we do have to address that, and we are looking at it. These are serious times, and they require straight talk and serious efforts. So to round out kind of this update, our Board of Supervisors this morning approved a moratorium on evictions. So that means that with good cause, individuals who have lost earnings because of the pandemic would have the opportunity not only to work directly with their landlords to identify functional plans, but they would also have protection against evictions. A large conversation came up around that, and I think it's very relevant about we can't just have a moratorium on evictions without having support to mortgage holders and landlords and rental assistance to individuals, because if you just have a moratorium on evictions, that assumes that everybody who owns a house that's renting it out has the ability to just keep people in those homes and not pay their mortgage even if they don't get rent from an individual. So we're going to have to supplement this and look at the state and federal resources and what we look towards locally. But that's very important to us. Additionally, here in Sonoma County and throughout many of our areas, we're asking for donations of personal protective equipment while we're waiting for masks to come in out of the Strategic National stockhold. I can't remember what the word is right now, but so on our website, socoemergency.org, you can find ways to donate that. You donate to the Salvation Army here locally. And then we're also working on, we've already expanded 50 spots, and we're looking to do more for childcare services for healthcare workers. We need to be able to backbone our healthcare workers so that they can do as much as possible. I know that's a lot of information. I know it's already a pretty long video, but I want to let you all know exactly what I know. And as somebody who is a local leader, my goal is to empower all of you out there to make informed decisions based on the best information that we have available, and then to also empower the other leaders out there to lead by getting them information into their hands. Always contact my office if there's any needs. District 4 at sonoma-county.org, 565-2241, 707-565-2241. Thank you. Stay strong. We're going to be in this for the long run, but we're going to be able to handle it if we follow doctor's orders and we do what we need to do. Appreciate all of you.